Now, democracynow.org, the War and Peace Report. We're on our Community Voices Community Media Tour. Today we're in Bozeman, Montana. Tomorrow we'll be in Boise, Idaho. I'm Amy Goodman in Bozeman, and Juan Gonzalez joins us in New York.
Greetings, Amy, and welcome to all of our listeners and viewers around the country and around the world. As Congress begins work on reforming the nation's healthcare system, Democrats are expected to use their majorities in both houses to push through legislation with few concessions to Republicans. More than 70 House Democrats reportedly told party leaders earlier this week that they won't support a bill that does not offer Americans the option of a government-sponsored policy. The committee chairman writing the Senate health bill, Montana Senator Max Baucus and Massachusetts Senator Edward Kennedy, have been criticized by progressive groups for bowing to pressure from the health insurance industry lobbyists. At an event earlier this year, Max Baucus, the chair of the Senate Finance Committee, plainly said single payer is off the table when asked whether it was an option.
I know that in the Helena Independent Record, you were quoted as saying that single payer health care is off the table. I'd like to know your reasons for putting single-payer health care off the table and intending instead to a mandatory insurance payment, or I'm sorry, purchase by Americans, which is an inefficient way of guaranteeing health care to everyone.
Well, I just have to make a judgment, and I think at this time in this country, the single-payer is not going to get even to first base in the Congress. And we're a big country. We're a battleship. We're an ocean liner. We're not a PT boat. We're not a speedboat. It takes time to turn those big ships. You just can't just turn them overnight. And we are, the United States of America. We're a different country. We're constituted differently than European countries, than Canada and other countries. We're a younger country. Where there's more of an entrepreneurial sense in America than those other countries. It's kind of go west, young man, and in America and so forth. So we've got to come up with our uniquely American result. And our uniquely American result will be a combination of public and private insurance, but one which everyone is covered. And just my judgment, and every member of Congress agrees with me, I think, at least those I've spoken with, that this is not the time to push for single pay. It may come later, but it's not going to happen in America, in my view. So I'm not going to waste my time pushing on something that isn't going to happen.
That's Montana Democratic Senator Max Baucus, seen as one of the most important figures on Capitol Hill around the issue of health care. Now, here in Montana is a vibrant movement that isn't quite as willing to take single-payer health care off the table and seeks to recognize health care as a universal human right. Last December, the Health Board of Lewis and Clark County, which includes the state capital, Helena, adopted a resolution that recognizes the human right to health and health care. In February of this year, the Montana State Senate held a hearing on establishing the right to health care in the state. State Senator Christine Kaufmann introduced the bill to make health care a constitutional right in Montana. While the bill did not progress, it's part of a broader campaign for the right to health care that'll continue this year. State Senator Christine Kaufmann, also the longtime director of the Montana Human Rights Network, joins us here in Bozeman to talk about health care and to give us an overall picture of what's happening in Montana. We welcome you to Democracy Now!
Thank you very much. It's great to be here.
It's good to have you with us. So you just heard Senator Baucus. Your response?
Well, Senator Baucus's plan, like so many that are gaining traction across the nation, is based on a market-based solution. And I think, this public-private partnership, we need to get past that, and we need to have a conversation that's rooted in values and in a human right to health care. I think part of the reason the single payer doesn't gain any traction is because it's not valued, it's not placed in the right kind of context, which is that health care really is a human right.
What does it mean to say health care is a human right?
Well, I think we have to first start by saying this needs to be a part of our founding documents, in our constitutions, and to be able to say that we as citizens can count on our government to be able to enforce that right. We need to count on them as an enforcer of a human right, and that it's something that's just part of what we get as citizens in this country.
Well, Senator Kaufmann, I'd like to ask you, what about the Max Baucus argument that it's time to move for what's practical, not what we would like, and that it's a waste of time to continue to pursue single payer?
Well, I think, Senator Baucus is really against, as I said, focused on this market-based solution. And we need to step beyond that. He's worried about what's politically practical and popular in this country. And he thinks it's not. But I think he's wrong on that count. There's been a number of surveys and so on that shows that not only Americans but also Montanans believe that health care is a right, and it's something that we should all have simply as a basis of being human.
And the continuing battle in Congress right now, with some Democrats saying that whatever health bill comes up, they do want to have some sort of government-sponsored aspect to health insurance.
Well, the plans of course gains popularity among the industry because his plan creates a mandate for all of us to purchase insurance. And that of course guarantees that we're going to be consumers of this commodity. And we talk about health care as a commodity, something some of us can buy and others of us fortunately can't afford. And we just need to get past all of that. Health care, again, is a right. It's not a commodity. And a guaranteed coverage, it's not even guaranteed coverage. It's saying individuals must purchase this commodity. And even coverage is not the same as care. I mean, we all know that you have to have a doctor that's within within the network, and you have to have the right kind of health problem in order to get covered. And so I think Max is just barking down the wrong tree here, and we in Montana need a human rights movement to put this in front of him, and hopefully that can spread across the nation. And
why do you think he is holding on to basically he's not saying he dislikes single payer. He's just saying it's unreasonable, it's not achievable, and so he's not going to go down that path. What are the influences on him here? What is Max Baucus's record?
Well, I mean, he sees out there the sort of political consensus around a market-based solution, and we need to really fundamentally shift that. And I think, we need, if we're going to set this whole debate into a different context, we need a movement that is rooted in people's values. People aren't going to necessarily just get behind a technical solution such as single payer, because that doesn't really move people. And I think single payer is the logical human rights argument here, or the logical solution that we're going to end up with, I believe. But we're not going to get there by just focusing on the specific program. We need to set this in a broader context. I think human rights gives us the language. We have a history of human rights struggles in the United States, and I think this is the way we begin to move that. And then people like Senator Baucus will have a context within which to place that solution, so that a single payer might make more sense to him.
A very quick picture of what's happening here in Montana on other issues, State Senator Kaufmann. Death penalty. There was just a major vote in the state Senate.
Yes, the state Senate, Republican-controlled body, did pass abolition of the death penalty a month or so ago. Unfortunately, it did not progress through the House. It died on a very close vote in committee there. I think it's beginning to show a shift in Montana in terms of our politics. You know, we're a very evenly divided state in terms of